That being said, why do you think, sunscreen, at least in the US, is regulated by the FDA, right? And the product, the manufacturing, everything else is much more stringent than any other cosmetic product out there. Why do you think there's so much fear? People are worried. There's so many concern about use of sunscreen. And first of all, maybe we'll just step back. Maybe you can share with everyone, like, what are some of the concerns, right?
I think some of the concerns are the absorption of the active ingredients of sunscreen, which is what we call UV filters, ultraviolet filters. These are the active ingredients of sunscreen that get absorbed into the skin. And again, there are data now to show, indeed, if you apply sunscreen on the skin, all these UV filters would be able to be detected in the blood. Not surprising, because anything that you apply on the skin, it would get absorbed into it. So that had caused a lot of concern and a lot of quote-unquote fear about the sunscreen producing a negative side effect on human health. I should emphasize that sunscreen has been in use in the US since the early 70s. And at this moment, really, there is no signal, no reports of side effect from sunscreen, internal side effect of sunscreen that is caused by UV filters. We do know that sunscreen can cause allergic reaction on the skin, which is not surprising. Anything that you apply on the skin potentially can cause an allergic reaction. It is not common, but sunscreen can do that. But in terms of internal effect, the science is again quite strong to say that there is no known side effect. There are always, individual factors that shows that yes, something may increase, something may decrease. But if you want to look at it in totality, it is still very, very safe. In fact, the studies, as you well know, of showing that the UV filters can get absorbed into the skin is done by the FDA scientists. Very, very nice studies. But even in that article, they make it very, very clear in the conclusion section that the clinical significance of this absorption of UV filters remain to be seen, that one should not refrain from using sunscreen, and there is no indication that sunscreen is not safe. So I think even in that article, that make it very clear that if you judge the benefits and the risk of sunscreen usage, the benefit being photoprotection, decreasing the rate of skin cancer, and the risk, it's this unknown health effect of UV filters right now, the benefit far outweigh the risk.
Yeah, I'm going to just flesh it out a little bit more.
Sure.
And I think we should talk a little bit about the physical sunscreen, the inorganic filters, the titanium dioxide, zinc oxide. Everything you talked about is the organic filters, right? And I just don't like the name chemical filters, because it seems like, because everything is chemical. I think that the context that people are labeling physical versus chemical, automatically people just have this erroneous assumption thinking that chemical is bad and physical is safer, right? Everything, the filters you talked about are quote unquote organic, quote unquote chemical filters. What specifically are people concerned about when they filters absorbed into the UV, and what biological concern do they have?
I think some of the concerns has been the hormonal effect. There are some mostly in animal studies to show that the absorption of certain of these UV filters, of certain of this organic UV filters can cause, would have hormonal effect in terms of disruption of hormonal activities. Again, these are mostly in animal models. In human, the data is not strong at all. So I think that is the main concern about that. And again, nowadays the unknown that anything that gets absorbed potentially could cause potential negative side effect. But I want to emphasize again that the data is not quite there.
Yeah, I mean, I think another thing we need to maybe mention is the usage level, right? The exposure level. And because I'll let you take over, because what the FDA study did and how much sunscreen they put on versus the reality, how much people put on. And I think that is something need to be mentioned.
Yeah, the FDA study uses the so-called method of maximal utilization test method, which is essentially applying sunscreen to the maximum allowable or recommendable level, meaning applying sunscreen at 2 milligram per centimeter square for their studies, which translate to about 1 ounce of sunscreen to cover the entire body surface. We know that in multiple studies, people have shown, we all have shown that in actual practice, individuals, including ourselves, we do not use sunscreen to that level. We use the average individual uses between 0.5 to 0.8 milligram per centimeter square, which is close to 1/2 to 1/3 of the level that the FDA use. Number two is that the FDA apply the sunscreen to individuals to the entire body surface. Again, for most of us, we do not apply sunscreen to the entire body surface because we have clothing on, we have swimsuit on, and so on and so forth. So, but their design was that to push the envelope essentially to see at the maximum level what type of absorption you would see.
Yeah, I just also like to add, I mean, not only they use the 2 milligram per centimeter square cover the body, everything else, but they repeated application every 2 hours, right? So I mean, I think that's like about, I think it was 4 times or something to that effect.
Yeah, correct.
And so in general, most people just don't do this.